There are different pharmacokinetics of the different esters of testosterone. I think every patient should know is that when you test your trough levels, it's important to test it, which is the time when you're doing your injection before you inject, before your next injection is due. That's when you would consider that your trough, and that's when you want to get your bloods tested to know whether you're too high or too low. The oil is so thin, such a thin oil, and it's such an easy injection. Lots of guys don't get the milligrams, that's the amount of your medication, and then the volume of your medication is how much room it takes up in the syringe. What does Mike use for his TRT? And I've used all the different esters, like I said in the beginning. I started with testosterone enanthate, with initially a little bit of testosterone propionate mixed in, followed by, I even tried patches before that, but when it comes to injections, it was a testosterone enanthate, testosterone propionate, testosterone Cypionate, in all different doses. I think the only one I haven't tried is testosterone Decanoate. I had tried testosterone propionate, 100 milligrams, 50 milligrams every other day to 25 milligrams daily. And what I'm on right now, as I said earlier, I'm on or prescribed 25 milligrams of testosterone propionate. I'm going to show you how to do a testosterone propionate injection. I'm going to show you how to prepare the ampoule, which different tools you might need or types of syringes you might need to make it easy. And then hopefully, if you are prescribed testosterone propionate, then you'll know that it's really not that hard. You'll know what to expect, and you'll probably look forward to doing it because the oil is so thin, such a thin oil, and it's such an easy injection. Now, it depends on what your dose is. So if you're prescribed testosterone propionate, you can have probably different variations. So one could be your daily, and daily could be anywhere from the full mil, which would be 25 milligrams, to half of a mil, 12.5 milligrams, to anywhere in between. And that will determine, because based on 1 milliliter, so basically you're 25 milligrams of a concentrate of the testosterone mixed within the volume, which is 1 milliliter. So lots of guys don't get the milligrams, that's the amount of your medication, and then the volume of your medication is how much room it takes up in the syringe. Okay, that's your volume. And so sometimes the volume doesn't always match the concentration, because if you don't know what the concentration is in the first place, you won't know how much is dissolved in that amount. And I'll give you an example. Testosterone Cypionate from Europe is 100 milligrams in 2 milliliters. And that really throws people off, because then you have double the volume, but you have 100 milligrams. Both of these boxes have 100 milligrams of testosterone in them. So this ampoule has 100 milligrams of testosterone, and it's inside 1 milliliter of solution. Slightly different ampoule size, a bit larger. So I have in my hands 100 milligrams of testosterone in this container and 100 milligrams in this container. There are different esters. One is testosterone Cypionate, and it's 100 milligrams with 2 milliliters of solution. And this one is 100 milligrams of testosterone enanthate in 1 milliliter of solution. They're both 100 milligrams. Your dose, if you injected the full amount of this ampoule, would be 100 milligrams. And if you dosed the entire contents of this ampoule, it would be 100 milligrams. But the volume that you would inject would be 1 milliliter, and this volume would be 2 milliliters. So let me show you what I mean. This syringe is a 1 milliliter syringe. And in this syringe, you would fill up the entire syringe with the testosterone enanthate, and it would deliver you 100 milligrams, but the entire syringe would deliver it. This is a 3 milliliter syringe. I would fill it up to the level number 2 on the syringe, and that would be your entire contents of this ampoule. It would fit into the syringe, and there'd be room left over. And obviously I would remove the air bubbles, but then I would be injecting 100 milligrams, but 2 milliliters of volume. So I would be going to level 2. So essentially, 2 of these, if it was double long, would hold this testosterone, and 1 of these would hold this testosterone, the enanthate. Okay, so that's the difference. There's not much in it other than a slightly larger size. Now, accuracy matters, and the larger your volume, you can be more accurate with the dosing. So if you've got 2 milliliters and you need a bit less, you've got a larger size, you can fine tune it more easily than you could with a smaller volume. And so I know a lot of men in the US who are doing TRT, they're using much, much smaller volumes, 0.1. So 0.1 would be to this marker here on this syringe. So it's a tiny, tiny amount. And it becomes harder and harder to get your right dosing when the amount's so small. It's very easy to overshoot it or undershoot it and not get your dose right. So having a slightly larger volume gives you more accurate dosing. So that's the difference between the two. So that hopefully answers your questions to what dosing and what milligrams and what volume is. And that's important because a lot of men don't know this, because you wouldn't know this if you didn't pay attention to knowing that your milligram dose is what your doctor prescribes, is the amount of medication you're going to get, how much volume that you'll inject. The two separate things, and every medication has a different concentration, and that's the amount of milligrams per the volume of solution that it falls in. How would you fill your syringe for testosterone propionate? How can we make it really easy for you if you're prescribed this daily? And like I said earlier, I'm prescribed testosterone propionate daily, or test prop daily. The testosterone that we have here, and the special testosterone that I said I would talk about if you kept watching toward the end of the video, is this particular formulation. And I'm going to show you what it's like in a minute with the syringe, so keep watching. And what's really nice is one box comes with 4 different ampules, and it'll last you 4 days, or depending on how you inject. The reason why I tap the ampule is because there's sometimes in any of the ampules there can be a bit of solution that's stuck to the top. And so we've had patients in the past that wouldn't pay attention. Like if you look at this one out of the box, there's, it will hold some of the liquid, which will give you less than what you're hoping to have. Okay, that's common. So you have to always flick the top before you open the ampule. What we do that's unique at BMH compared to other clinics or locations is we have basically introduced into the industry using, and we're the first to do this, a needle filter. A needle filter, it has basically a tiny, I think 5 micron filter that helps remove glass particles from when you open up an ampule. So it's sometimes for certain patients who are used to the multi-dose vials, they wouldn't use this because this is quite a blunt tool which could core out your multi-dose vial. So you wouldn't know this one. But if you're using ampules, it's really important that you have a tool that's large enough to remove usually a viscous oil. In the case of testosterone propionate, it's not as thick and viscous as other testosterone formulations, but still, it's better to have something that filters out any particular glass particles, because when you crack open the ampule, it will leave micro fragments of glass particles within the solution, which you don't want to be injecting into yourself. So this helps prevent that, especially if you're doing the injections every single day. I mean, if it happened to be where you didn't have, especially years ago, I didn't have these needle filters, but if I'm doing this day in and day out, I think having a needle filter makes the most sense. And we can provide that through our pharmacy, The Hormonist, or through Balance My Hormones when you're a patient. This is part of your injection bundle. And as you can see, with the injection bundle, we have it right here. Now, with the injection bundle, we do have a warning: do not ever use this pink needle to inject with. And we've had heard stories of people who didn't follow the instructions and tried to inject with this. This is for the sole purpose of filling your syringe. And then you can inject with various different needle sizes. There's a 23 gauge needle, 1 inch, if you're going to do a deep intramuscular injection. There's also a 25 gauge needle, 1 inch, which you would use for an intramuscular injection. So these are the two, one's blue, one's orange. Or if you're going to do a shallow intramuscular injection, or even a quad injection, or even a shoulder injection, you've got a 27 gauge, 1/2 inch needle, which would go on top of your 1 ml syringe, or a 3 ml syringe if you're injecting the entire contents. If you're injecting 25 milligrams of full 1 ml, it will fit into the 1 ml solution, but you may lose just a little bit. So if you want to get the full 1 ml, you can go to a 3 ml syringe. And you might ask, why not use a 2 ml syringe? And I've just found personally with the BD 3 ml syringe, it's a bit smoother because the 2 ml, for some reason, seems to, you have to push it, put more force to push the oil through. And that might be uncomfortable for some patients. You have to really, really push it, where the 1 mls are quite smooth, but you may not get the full 1 ml. You might get 0.95, 0.9, so you can get a little bit shy of what your dose is. So it's really, you know, patient and doctor preference. Right, now I'm going to show you how to open the ampule, how to fill the ampule, and then what you might need to do going forward. So one of the first things that is important to have, I think it's just common sense, is to wipe the outside of the glass ampule with an alcohol swab. So here's one of the 25 milligram in 1 ml doses of testosterone propionate, and you're going to wipe the outside of it. Okay, give it a nice clean. It's just probably good practice to do that. Okay. Then the next thing I do is I prepare the syringe, and in this case I'll fill this 1 ml, and then I'll show you what I mean, and I'll fill the other 3 ml. So with the 1 ml, when I say prepare the syringe, I'm going to open it up. I usually set it down, and then I'm going to take the needle filter, I'll open it up, making sure not to touch, and I'm going to hold it in my left hand, and I'm going to grab the syringe in its packaging, and I'm going to pull out the syringe, making sure not to touch anything, and then I'm going to attach them. It's called a lure lock. It screws in. It's a lure lock and it screws in, and that's how I make it work together. Now, I'm quite good. I usually just hold this in my hand and I'll open the glass ampule. On this particular one, the testosterone propionate, there isn't a dot. Most of the other ampules will have like a little blue dot that guides you. What I may do as a guide is I'll look at where the labeling is, but I've also opened other ways. The key to all of this is never pull in towards you, always push out, always snap it away from you. So regardless if there's a dot or not, you hold one with your one hand, in my case the left hand, and then in your right hand you put your thumb kind of right where the neck of the ampule is, and you kind of hold it. It's really quite quick, and you just do a quick snapping motion, making sure not to rub your fingers, and that's all you have to do to open it. Then what I'll do is with my other hand, I'll pull off the cap. Some people use their teeth, but probably it's best to use your hand. And then you put it inside the ampule. And then once it's inside, you can draw it out. And now I want you to see it's quite thin and it fills up very nicely. But you're going to see this particular syringe, if you pull it out too far, you will pull the plunger all the way out. So you have to be very careful not to pull the plunger out. And you can see I'm filling it up. But there's something, so I'm getting to the end of this, and there's a bit of a gap. And I've reached the point where I've pulled out just more than a mil. Or just about a mil, and it's just a tiny bit left inside. But see this bubble? So you gotta be careful. The bubbles can go towards the top. And that's about all I can do. Now I can try to pull it back just a slight bit. You gotta be very careful. You gotta be very careful that. So that's about it. You can't be greedy, and you gotta be careful if you tap this. You might want to hold the plunger with another finger. But I think that's about all you would do on this. Then you can either take it. I usually put the cap back on as a way to, and I twist off the top. Okay, and then that's my syringe. And then with maybe another finger, I'll open up and making sure that the top of this doesn't touch anything. So that's why I have it in between my fingers. And I'm opening up the. I guess I'll inject it as a 1 ml. So I'm using a 1-inch needle. If I could do an intramuscular, and I can simply just screw it on like that, ready to be adjusted. So there's that air bubble which I want to get rid of, and that is what I'll do before I do the injection. I've got another needle here, which is a 27 gauge needle. I want to show you what it looks like. It's a lot shorter, and this is quite good for like quad injections. So if you look at that here. Here's my 25 gauge needle, and again it's on there, no problem, quad injections done. And then I just push up like this, and I'll show you if I take the needle off. I don't know if you can see that, and there's still a little bubble, and I just want to push it up, and that's it. So there's no bubbles. Okay, so this is ready to inject, and at this point you wouldn't want to set it down. Now, as you can see, my dose between 0.9 and 0.8. On this particular syringe, you know, it's not easy to just pull the whole amount out. So my dose is going to have to be closer to 0.9 or 0.8. So between, like, you know, 18 and 20 milligrams dose, which is reasonable to do daily. If you need to go to the full 25 milligrams, I would recommend using the 3 ml syringe. And then I can, you know, to push it out, it's very, very, very easy. You know, it's not tight at all. You know, I'm just being very careful not to take too much out. All right, so that was, that's the 1 ml. And I can put this back in the sleeve just for the second. You don't want to store these in the syringes. You know, you want to leave them out for minimal time. I mean, you know, a few hours is probably the most you want to store them for. So now let me show you how to open this up, what it looks like with the 25 milligrams in the 3 ml size, the testosterone propionate. It's very, very easy. Again, it's the same way. I've got a filter needle. I've got my syringe, 3 milliliter syringe, and I've got the testosterone I'm going to open. And like I showed you before, I'll wipe down the outside of this, make sure there's no bubbles. I'll open up my packaging for the 3 milliliters. Okay. And I've got the needle filter so we can filter out the glass particle. And really, for ease of use, I can just put them together now. I can assemble them almost like a space station docking. And again, it's a screw on. It's called lure lock. Okay, and now I'll open the Ampoule, and I'm going to just open it by clicking away. Grab my syringe with the needle on top, and now you can see it's a much fatter needle. It goes to 3 mLs. There's only 1 ml of volume in here. Put it through the opening, and with this one, I don't have to be as careful. The back of the needle, I believe, comes out. I'll show you how far it goes. But you can hear that sucking sound. Now I've reached the bottom. I've got all of it out of this one. So if you're ever in doubt, you need to get the full contents out. It's all out. And the other benefit of it is there's still more room. So as I pull back, this one locks. So this particular BD syringe, I can't pull it back any further. The other one, if I pull back this far, it'll come out all together, but it kind of locks. And there's a lot of air. And by having this air here, I can see that it's going to pull it from that syringe because there's still some oil within the needle filter in the top of the syringe. And that's about the best I'm going to do to get it out. And I can kind of push it back and forth, but it's relatively smooth. Okay, and then I would then decide which needle I'm going to inject with. So let's say all I've left now is my 25 gauge 1-inch needle. And then again, it's a lure lock, and I screw it in. And then you adjust. Again, this is relatively easy to adjust. You know you've got 1 ml of solution, and so again, if you're going to have 1 or 2 milliliters, you would probably use this needle. Now, what would you do if you needed to? Your dose was 50 milligrams, or even 40 milligrams. Well, in that scenario, you probably would have put a different needle on. So you wouldn't. Let's say we're at this point, and we were. And again, we're not going to inject these. Let's say we would have a different syringe. Okay, so let's say you needed to fill up the double dose of this. What I would recommend, obviously, is before you did what I did, taking the top off, I would leave this on. Okay, and then you would have it adjusted, and then you would just open up a second Ampoule. Okay, and so here's a second Ampoule. You're going to twist this off, and then snap it open. Again, be careful the sharp edges not to cut yourself. And then you would fill up your second part of the, and you're just going to fill it up, and again, okay, and you can hear a bit of that sound. It's kind of just sucking out the rest of it. Again, about as far back as you can go. It's locked, and so now we've got 2. Now that's 50 milligrams or 2 milliliters in a 3 ml syringe. And you can see now you can fine tune the amount. So if you need a bit less than that, then you would fine tune it after you remove the the filter needle. And the reason why you would do that, because you're not going to know how much you need to inject until you actually put the right needle on that you'd be injecting with. As you prepare the needle for the injection, you want to make sure all the air bubbles are out of it. So again, that's essentially, you can see there's small bubbles. So you keep tapping it if there are bubbles, and the bubbles should rise to the top. And you can kind of push them out. And where are we on this? So it's actually slightly more than 2 mils. So again, the 2 mil mark is here, and you would fine tune this to about right with the middle. I don't know if you can see that, to where it says the 2. And you can see the oil's not that, but this one does require a bit more pushing. So I'm thinking what we can inject in that gives you an idea. So I'm going to inject this back into the container. I'm just showing you how the pressure is, if you can tell, by using the 3 ml. So you had to put quite a bit of pressure with this type syringe, okay? Oh, sorry. The pressure of the syringe was also the size of the needle. This is 25 gauge needle. Now watch as I change this out. And this is a 23 gauge needle, so it's a bit fatter and the pressure should be a bit less. So I'm going to fill up, again, I'm going to discard these when we're done, but this one goes up, it's a bit smoother. It's still a bit of pressure, but it's still quite smooth to inject in. And it's one of its advantages, but slight disadvantage over the other syringe. Now this is the 1 ml that I was telling you about. And with this 1 ml, it's very, very smooth. This is a 27 gauge, so it's even smaller. So the 25 gauge is a very, very small opening. This is smaller still. And then the 23 gauge is larger. So the higher the number, the smaller the needle, which means there's a smaller opening to go through. And when you inject it, it's still you got to put some pressure, but it's still very, very, very smooth. I know some people watching this think I'm wasting all the testosterone, but I think it's very important for demonstrating how that's how you would proceed to do the injection. And then obviously when you're done, you discard everything to a sharp spin, which we don't have on display, and do your injection that way. So hopefully that shows you, if you're one of our patients, how you would use the testosterone propionate to do the injection, that there are different tools, different syringes that you would use depending on what your dose is, and that it is very possible and easy to do the injection of all different sizes, what some call microdosing, to do that with the tools that we have here in the UK. And you don't have to use testosterone cypionate, because you've got 1 ampule, 1 dose, or 2 ampules, 1 dose. It makes it very easy, because now if one of my ampules is broken, I've got on my order. So I can break one of the ampules, I might still have 3 left in this tray. I can break a whole tray or a whole box in the tray, and I still have maybe, between 4 and 8 other boxes that have the individual sizes that I need for injecting. If my dose is more than 25 milligrams, the doctor will prescribe me 2 ampules per dose every other day. So you've got lots of different options when you're at balance by hormones, especially for microdosing. And I think one of the best ways, one of the safest ways, is to have testosterone propionate on a more frequent basis. So that's my latest, and a little bit of a bias, because I think it does work, especially if you tried other esters. But even if you are trialing, daily dosing of testosterone cypionate, you might want to give testosterone propionate a try, especially if there's a lack of availability of the multi-dose vials of testosterone cypionate. And having this makes it a little bit easier, especially if you're using the 1 ml, but even the 3 ml wasn't that difficult to push the liquid out, to push the volume out. And yeah, so anyway, I hope this video helped. I hope it made sense what I was talking about. And for those who are just starting on their TRT journey with Balance My Hormones, this video is an instructional video for you, so that you can know what to do, and that should help you overcome any obstacle that you may have thought about in the past. So just to recap, testosterone propionate is a very excellent option for your TRT protocol. It can be prescribed daily, every other day, sometimes even every 2 to 3 days, but majority of patients will see this option as either daily or every other day. If it's every other day, you can do 1 ml every other day, and if your dose is a bit higher, you can do 2 mLs every other day, which would be a dose of either 25 milligrams or less, depending on your prescription, or it could be up to 50 milligrams for two. Essentially, you would do 2 ampules or 1 ampule, or any variation thereof. Thanks for watching Balance My Hormones. If you found this video helpful, please give a thumbs up, share it with a friend, and hit the subscribe button for more TRT and HRT insights. Explore our website at balancemyhormones.co.uk for our blood tests, our free testosterone calculator, and all the tools you need to take control of your health. Together, we're making hormone therapy simple, safe, and effective. See you in the next video.